Aboriginal and Torres Strait Islander people should be aware that some of those depicted in this video may have since passed away.
Thanks for helping close the 17-year life expectancy gap between Aboriginal and Torres Strait Islander people and other Australians. Over the last century, the life expectancy of an average Australian has increased dramatically. I can expect to live to an average of 82 years of age, whereas an Indigenous woman can expect to live to just 65 years of age. I'm here today at the Redfern Aboriginal Medical Service, and I've just been absolutely touched by the amazing things that have been going on here for years. So please join me and show your support for the Close the Gap campaign.
Aboriginal men suffer heart disease and stroke at 3 times the rate of other Australian men. Aboriginal and Torres Strait Islander women are 5 times more likely to die from cervical cancer than non-Aboriginal women. Aboriginal children are dying at 3 times the rate of non-Indigenous children. Aboriginal and Torres Strait Islander peoples die on average 17 years younger than other Australians.
I remember a young Aboriginal boy who changed my life. He was 4 and I was a young doctor in a children's hospital. He came in with severe dehydration and gastroenteritis, and we were so proud that we turned him around, but we discharged him back into the same community that caused the problems in the first place. On the next admission, he died. Our modern medical miracles were no match for the horrendous living conditions and the lack of resources in his community. That child's death had a major impact on me. It taught me, amongst other things, that the tremendous disadvantage facing Aborigines has a complex set of causes. It also taught me that if we are to answer the Indigenous health crisis, we need not only to have adequate funding, but a set of clear, specific, long-term targets with an approach that builds community resources and capacity and is consultative and not marginalising. There have been many success stories in Aboriginal-controlled health organisations. With adequate support and funding, these success stories are the logical start to any broader plan to close the gap.
The current federal, state and territory governments appear to have grasped the depth of the Indigenous health crisis. They've made the commitment to close the life expectancy gap within a generation and to halving the mortality gap for Indigenous children under 5 within a decade. But if this is to be achieved, then it's successful health programs like the Women's and Children's Clinic at the Victorian Aboriginal Health Service that desperately need proper funding. This unit looks after more than 800 regular clients, including 518 children under 5. It supplies maternal and child health, paediatric and vaccination services, services that are central to child development and increased life expectancy. The Victorian Aboriginal Health Service consistently records an average 91% child immunisation rate. This is well above the 85% for all other children in their division and dwarfs the figure for Aboriginal child immunisation rates across Victoria, which is less than 50%. But despite these great outcomes, the Women's and Children's Unit is seriously underfunded. This Aboriginal Health Service gets almost 50% less funding than a local council would receive for delivering the same services. Aboriginal and Torres Strait Islanders are taking steps to meet the health challenges they're facing, but underfunding of services like this Women's and Children's Unit in Victoria means that it is difficult to recruit staff. They are often paid less than those in mainstream health services, and work is often skewed to crisis management rather than providing a comprehensive maternal and child health service for all children. There is similar underfunding of other successful Aboriginal controlled health programs, including the Living Improvements for Everyone or LIFE program. With adequate funding, the LIFE program could be extended throughout South Australia and around the country.
The LIFE program was run by the Pickaway Health Service in Port Augusta and the Spencer Gulf Rural Health School from the University of South Australia. And the program builds people's knowledge on how to live with a long-term illness. The LIFE program is a fantastic program of how, working together, we're able to tailor successful cost-effective programs to the needs of Indigenous communities. We must ask ourselves, however, as it's worked in South Australia, why isn't it available in all Aboriginal and Islander communities?
Indigenous Australians are asking for adequate funding for basic health care. They also want to join the health workforce and look after their own communities.
There are currently less than 100 Indigenous doctors in Australia and about the same number in training. These numbers represent a tiny proportion of the Aboriginal population and a proportion far smaller than those represented by the number of non-Indigenous doctors in the wider Australian population.
Despite the terrific work being done by Aboriginal health workers, the lack of adequate funding for Indigenous health is a story repeated around the country. The fundamental importance of community-controlled healthcare is another point that is stressed by Aboriginal and Torres Strait Islander leaders.
Rumbalara's focus here at the organisation is to support families and clients in a holistic way. That being health, could be family services, it could be support in aged care. All of those programs, or the service areas we have, we ensure that there's an internal referral system through all of those, so that where it's identified that someone needs a number of supports, that we can do that, and we can provide that all here at Rumbalara. I think they can be made more successful if they're funded adequately. Diabetes is high in Aboriginal communities, but our diabetes program at Rumbalara is unfunded. That's the only way we're going to close the gap, is to have adequate health funding. Fund us properly and support us.
Over the decades, there have been lots of good intentions and many promises from governments at all levels to deliver Indigenous health equality. But time and again, our people's hopes have been dashed. We continue to suffer rates of disease and death similar to people living in the developing world. We're only asking for health equality. All Australians deserve equal access to health care. We're no different. We thank the new federal government for giving Indigenous issues priority so early in its term, including its commitment to closing the gap in life expectancy within 25 years. It was also heartening to hear the Council of Australian Governments committing to take coordinated action around the country to address the Indigenous health crisis. But if we're to avoid the mistakes of the past, governments must now deliver on these promises. To do this, they must establish a long-term plan in consultation with our people. This plan must receive adequate funding and include clear targets if we are to build the capacity of Indigenous health services and achieve Indigenous health equality. Top-down, inadequately funded and uncoordinated solutions have not worked. This time must be different. Thank you for your support to end this health crisis. Please continue the journey with us as we work with governments and our communities to close the gap.
I think it's an excellent campaign. It's actually something that is achievable. It's something that we can do to make our country a better place.
I love our land and I love our Indigenous people and I love our history, and I think we should embrace it. And particularly today, it's about raising the standard of health for our Indigenous people. So I'm behind it 110%, as well as reconciliation. So get behind Australia.
Come on!